The next thing we'll discuss is a high-level overview of how to navigate the different parts of Medicare coverage. Medicare is our country's health insurance program for people age 65 and older. It can be complex and without proper guidance can lead to misconceptions and gaps in benefits. A clear understanding of exactly what Medicare covers, and perhaps more importantly, what it may not cover, can help you better plan for your healthcare in retirement. Some retirees may select Original Medicare, which includes Part A and Part B, but others may find Original Medicare is lacking for their situation and may decide to supplement with Part C, Part D, or Medigap coverage. In some cases, that may mean paying additional premiums for this additional coverage. But first things first, let's go over enrollment, because one of the most important parts about enrolling in Medicare is when you enroll. The overwhelming majority of you will enroll in what's called the initial enrollment period, which is the period of 3 months before you turn 65, the month of your 65th birthday, and then 3 months after you turn age 65. This period encompasses the 7-month window for the initial enrollment period. It is recommended to sign up 3 months prior to your 65th birthday to avoid delays in coverage. If you miss out on enrolling during the initial enrollment period, your next opportunity is likely during the general enrollment period. The general enrollment period happens every year and lasts from January 1st to March 31st, with coverage starting the first month after you sign up during this period. If you miss this window, you must wait until the following year's general enrollment period and may pay late enrollment penalties. Reviewing your Medicare coverage once enrolled is also an important part. Coverage does not need to be a set it and forget it. There are open enrollment periods annually in which you can switch coverage. Finally, there are some special circumstances that would allow you to enroll after the initial enrollment period and outside of the general enrollment period. The special enrollment period is only available for a limited time, as its name implies, and for certain situations. There's a list of these special circumstances on the Medicare website, so if you think you may be eligible, I urge you to check it out and discuss it with your advisor. Lastly, if you miss the window when signing up when you're eligible during a special enrollment period, you'll have to wait for the next general enrollment period and again may have to pay a late enrollment penalty. Now that we've covered the basics of enrollment, let's dig into the nuances of each part of coverage. There's a common perception that once someone is eligible for Medicare, healthcare costs are eliminated. The good news is that Part A, which is hospital insurance coverage, is provided to most people, about 99% of Medicare beneficiaries, according to the Medicare website, without a premium payment. Part A would be premium free for those who have worked or had a spouse who worked at least 10 years and paid Medicare taxes during those 10 years. As noted in the chart, there are deductibles and co-payments for the services received. This chart reflects the 2025 amounts. Even if you're still working and covered by an employer-provided health insurance plan, if you're age 65 or older, consider enrolling in Medicare Part A if it's premium-free for you. If you have both coverages, the employer plan generally pays first, and then Medicare would become the secondary payer, hopefully reducing any out-of-pocket costs you may have. You will want to work with your benefits administrator to see if this coverage could apply to you. If you do have to buy Part A and it's not premium-free, and you don't buy it when you're first eligible for Medicare, your monthly premiums may increase by 10%. Medicare Part B is used to cover medically necessary services like doctor and outpatient care and preventative services. Benefits could include doctor's visits, outpatient visits, diagnostic tests, and outpatient therapy. Generally, you enroll in Medicare Part B when you enroll in Part A, unless you are still covered by your own or your spouse's employer group medical plan. If you miss the initial enrollment period for Part B, then you will either need to qualify for special enrollment or you must wait until the next general enrollment period. However, if you don't enroll when you're first eligible and do not have alternative coverage, premiums will increase by 10% for each 12 months until you enroll. So if you mistakenly miss enrollment for a full 5 years, your premiums will increase by 50%, and the premium late enrollment penalty is permanent. Unlike Part A, Part B premiums vary annually depending on your income, and it's on a sliding scale. The standard monthly premium for Medicare Part B enrollees for 2025 is $185 per month. This means that regardless of income, Part B beneficiaries will pay at least the standard Part B premium of $185 per month in 2025. How much you pay above and beyond that $185 per month is again dependent on your income, with the highest monthly premium being over $600 per person per month. The monthly adjustment amount, sometimes called IRMA, reflects applicable fees due to higher modified adjusted gross income. The total monthly premium column reflects the base $185 per month premium, as well as any income-related adjustments. You will be notified by Social Security via mail if a monthly adjustment amount applies in your situation. There are some financial planning strategies you can implement to try to lower your Part B premiums. Premiums for Part B are means tested, which means monthly premiums are based on your income. If you're not aware, your Medicare Part B premiums are based on your modified adjusted gross income from 2 years prior, and the Social Security Administration adjusts the fees annually based on your federal tax returns, which are automatically provided to them by the IRS. This means that planning starts now for future premiums. Your financial advisor can help you consider if the following work in your financial plan. You could consider completing Roth conversions now, which would reduce IRA balances and therefore reduce future required minimum distributions that could push your income and therefore Part B premiums higher. You will want to be very mindful of the amount of conversions, as they could push your modified adjusted gross income over a premium threshold, the opposite of what we're trying to do. Another way to reduce your income is to consider ways to reduce investment income. In taxable accounts, you can work with your financial advisor to consider things such as ways to reduce capital gains distributions and ongoing tax loss harvesting. Another way to potentially reduce your modified adjusted gross income is to maximize IRA, 401k, or HSA pre-tax contributions, assuming you have access to these accounts and earned income. You can also determine if using HSA funds to pay for Part B premiums fit well into your retirement strategy. Part C coverage is also called Medicare Advantage. These plans are offered by private companies that contract with Medicare. These plans must cover all medically necessary services that Original Medicare, which again is Part A and Part B, cover, and some plans may also offer extra benefits. And Part D is also included in most Advantage plans. Part C plans can be a good fit for those that need their coverage to be tailored to support certain health conditions, and can also offer benefits such as access to clinical trials, which is not covered under Parts A and B. But you may need a referral to see a specialist, and in many cases, you can only use physicians and providers who are in network. You can enroll in Parts A and B, or you'll enroll in Part C, but not both. If you enroll in Part C, you'll pay the monthly Part B premium and may also have to pay the plan's premium. Some plans have zero premiums and may help pay all or part of your Part B premium. Unlike Original Medicare, where there's no yearly limit on what you pay out of pocket unless you have supplemental coverage, Medicare Advantage plans do have a yearly limit on what you pay for covered Part A and Part B services. Once you reach Part C's plan limit, you'll pay nothing for covered services for the rest of the year. Part C plans have varying types, varying out-of-pocket costs varying premiums and varying benefits, and they're actually based on the county of residence. And the in-network provider pool in Medicare Advantage plans may be smaller than those that are offered in Original Medicare. There are many details to consider when deciding between Original Medicare and Medicare Advantage plans, and you'll want to review your options carefully. Part D Medicare drug coverage is optional, but it is available to everyone with Medicare. Coverage can be purchased through a Medicare Advantage plan, as we just discussed, or through a standalone Part D plan. Each plan varies in premium cost and specific drugs covered. As of this year, Medicare Part D enrollees now benefit from a new $2,000 cap on out-of-pocket prescription drug costs. That includes any deductibles, copays, and coinsurance, but not premiums. This change was part of the Inflation Reduction Act of 2022. And once you reach that $2,000 limit, the plan will cover 100% of the cost of covered medications for the rest of the plan year. Also, even if you don't take any prescription drugs now, consider signing up for Part D as soon as you're able. The Part D late enrollment penalty is calculated by an extra 1% for each month, so 12% a year. If you miss all 12 months, you were eligible to join Medicare drug coverage and didn't have any other credible prescription drug coverage. This monthly penalty is added as long as you have Medicare drug coverage, even if you switch to a different Part D plan. If your circumstances and/or medication needs change, you have the ability to change your Part D plan coverage annually during the open enrollment period, which is usually from October 15th to December 7th.